Hi everyone, this is Harshita. Welcome to TeddyGHC channel. So today in this video we are going to discuss an important topic, that is microcytic hypochromic anemia. First one is microcytic, means if RBC size or MCV is less than 80 femtoliters, then it is called as microcytic. Hypochromic means MCH value is less than the 27 to 32 picograms. If RBC obeys these two conditions, then it is called as microcytic hypochromic anemias. And there are four situations. We remember it with a mnemonic called as SITA. S for sideroblastic anemia. So there are four conditions in which we can see microcytic hypochromic anemias, and they can be remembered with the mnemonic called as SITA. S for sideroblastic anemia, I for iron deficiency anemia, T for thalassemia, and A for anemia of chronic diseases. In these four diseases we can observe microcytic hypochromic anemia. Okay, now in this class let's discuss about the iron deficiency anemia. Iron deficiency anemia. First, let's discuss what are the reasons, like causes. First, let's discuss what are the possible ways of getting iron deficiency anemia. So there are four chances in which a patient can get iron deficiency anemia. First one is decreased intake. Second one is increased demand. Third one is impaired absorption. And the last one is chronic blood loss. So these are the situations in which the patient may get iron deficiency anemia. So first one, the intake of iron is very less. Why? Why the patient or the person is taking low iron? It may be because of poverty or because of low economic status. Low socio-economic status. The both may be same sometimes. Next one is high demand. There are situations in which we need more amount of iron. They are puberty. We know the person will be in growing stage, so he need more amount of iron to satisfy his need. Next one is pregnancy. Next one is lactation. In third one, it may be due to impaired malabsorption syndromes. Vitamin B12 deficiency caused by fish tapeworm, or in chronic blood loss, for example in GI or colon malignancy. And there are some reasons in which we can get worm manifestations. In worm infestations like ankylostoma duodenale, in these situations we can observe iron deficiency anemia. Okay, it is also called as hookworm. So these are the most common causes that a person may get iron deficiency anemia. Next one is, what are the factors that influence? Like there are certain factors which increase the absorption of iron, and there are some factors which decrease the absorption of iron. So let's talk about the factors. The factors are of two types. First one, which increases, okay, let's select bright color, increases iron absorption, like acidic pH, vitamin C, or ascorbic acid or some amino acids and citric acid. And there are few examples in which we can observe decreased iron absorption. They are alkaline nature, alkaline pH, tannins, phytates, and tea. Okay. For example, you suggested a patient to take iron supplements. So before taking the iron supplements or after taking the iron supplements, we should inform him that he should take citrus fruits like lemon, amla, etc. And before or after taking the medications, he should not take tea or the food contents that are containing phytates and tannins. Okay, so you should tell him that he should take some food that increases the absorption of iron, because he is already in supplements, and if he take tea or the food products that are containing phytates, the absorption still decreases, or the body may not absorb sufficient amount of iron that we are providing or that his body is needing. So these are the conditions you should remember and you should advise your patient. Okay, next so for example, a common person should take 20 like 10 to 20 milligrams per day. 10 to 20 milligrams of iron should be taken. Distribution of iron in our body, the iron is distributed in two forms. First one is heme form, next one is non-heme form. So in heme form, we can observe 80% is in hemoglobin Hb, 80% is in hemoglobin, and the remaining 20% is in the enzymes. Okay, and next one is the iron that we are taking in the food may be of two types. First one is ferrous, next one is ferric. In our body, the iron is mostly absorbed in the form of ferrous, and it is mostly absorbed in the duodenum. The iron is utilized, the remaining is stored in the form of, these are the storage forms: like ferritin. Second one is hemoserine. So these are the storage forms of iron. The iron wants to be transported, it is transported in the form of transferrin. So this is the transported form. So up to now, we discussed about some of the causes that causes the iron deficiency anemia and some of the important points that one should remember. Okay, so let's go deep into this by learning the mechanism of iron absorption. Mechanism of iron absorption. We know iron is absorbed in ferrous form. Fe2 plus is the form in which iron is absorbed, and in non-heme, iron may be in Fe3 plus form, and it should be converted into the Fe2 plus form. So let's draw a diagram. Duodenal enterocyte. Duodenal enterocyte. This is the apical part, Let me change the color. This is the basolateral part or border. For example, we taken a food item. It contains Fe3 plus. So this Fe3 plus should be converted into the Fe2 plus. That's what we discussed it, right? So there is a enzyme called as divalent metal transporter 1 receptor, and duodenyl cytochrome B enzyme. Duodenyl cytochrome B enzyme. So with the help of this, the iron which we are taking is converted into the Fe2 plus, and it will enters the duodenyl enterocyte. From here it will reaches to the border, basolateral border, and from there it converts into, from there with the help of ferroportin. These are ferroportin, nothing but the channels that sends the iron out. So from this the Fe plus 2 will come out. Now this Fe plus 2 will again convert into Fe plus 3, and they moves to various parts of the body. So it is observed in the form of Fe plus 2, but it is transported in the form of Fe plus 3. So it may also be called as transferrin. So this is the mechanism of absorption of iron. I hope you are clear. Let me explain this again. This is the villi of the duodenum or duodenal enterocyte. Here Fe plus 3 is converted into the Fe plus 2 with the help of an enzyme called as duodenal let me change the color. With the help of an enzyme duodenal cytochrome B. Okay, and with the help of a receptor called as divalent metal transporter, the Fe plus 2 like ferrous is transported into the duodenal enterocyte. Okay, and some are stored as mucosal ferritin, and some will move out through the channels ferroportin. From there Fe plus 2 will convert into the Fe plus 3, and it combines with the transferrin and it moves to various parts. These parts may be like liver and bone marrow. Okay, so this is the mechanism of iron absorption.